It's taken me a long time to figure out why I like oncology so much, but it joins together so many aspects of medicine. We have to keep ahead of the science, figure out what is the best treatment for any patient. We have to keep current with affairs. We have to work with a lot of people, the surgeons, the radiologists, the radiation oncologists, the pathologists, so it's a big team effort. The other part of it is I really like being with the patients. Our oncology patients we get to stay with for a long period of time. We get to know them, their families. I know what's going on in their lives, and I love that aspect of it. I think the biggest philosophy for any patient is treating them as an individual. Everybody comes to us with different things going on in their lives, different medical issues, personal issues. So you have to tailor everything you do toward that patient, what works best for them. You have to take into account the whole social situation. What is their social support? What is their church support? What is all of this that's going to help them through any kind of treatment? So that's part of what we learn the very first time that we see them is what's going on with your life. Well, I was raised in Jackson. I graduated from high school in Jackson Prep, went to Mississippi State, so I'm a Bulldog. Went straight from there to Ole Miss Medical School, graduated from there, and did a chief residency for a year. Then I did 1 year of fellowship in hematology and oncology, and that was really to give me time to actually earn enough money. And then we went over to Seattle, Washington, and I spent 2.5 more years doing a fellowship there. I went there for several reasons. One, I wanted the bone marrow transplant experience, and they're the people that started it, so they certainly know a lot about bone marrow transplant. The other aspect was I wanted to go to a different part of the country, be sure that I wasn't nailed down to a certain way of thinking. I wanted to know how other people thought about things. And actually it was a great experience because I found out that yes, my training was adequate, it was good, that most doctors have the same way of thinking about people. They may tweak their treatments just a little bit here and there, but it was a very comforting thing to know that yes, we are all in this together. I have particular interest in leukemias because that was a lot of my training in Seattle. I enjoy the fight of that, getting all my armamentarium ready to treat that. I'm with the patients day in and day out, and they can be hospitalized for a month at a time. So it's a bonding experience with the patients, kind of going through thick and thin with them. I do a lot of breast cancer. We all do breast cancer, lung cancer, colon cancer, so the common things we all treat. I see my role as an oncologist to help the patient and their families along with their disease. I don't want them to be engulfed by their disease. I want them to continue to have their normal lives. I want them engaged in all their activities. My job is to be a support and to help them along the way.